Once again, South Boston and the waters of Dorchester Bay will be the setting for the annual Columbia Threadneedle Investments Boston Triathlon. To tell us about this year's event and the goals of its charity partner, Boston Medical Center, are the company's head of the North American Marketing, Leslie Walstrom, and from Boston Medical Center, the Vice Chair of Primary Care Innovation and Transformation, Dr. Katherine Gergen Barnett. Thank you both for being with us.
Thanks for having us.
And you're both participants here. I want to start with Leslie, a little bit of the history. How does a sort of a financial service company get wrapped up in a triathlon in South Boston?
Yeah, it's a great question. So our company was globally involved with the International Triathlon Union. So that's actually where Olympic athletes go to compete and participate. We sponsored on a global level, but there was not a U.S. ITU event, and so we're largely based in Boston, and so we found a partner here in the Boston Triathlon, which is the only triathlon event in Boston. So we made a connection several years ago, and we've just kept it going.
Well, speaking of partners, you also have a charity partner, Boston Medical Center. Explain the connection there.
Sure. So Boston Medical Center was actually the charity partner of the Boston Triathlon before we came on. But for me personally, I've been involved with BMC for a long time, and that was a huge selling point for us actually forming a partnership with the Boston Triathlon. It's a charity I know really well and felt really comfortable with them. And so I think there's just been added benefit for us and for Boston Medical Center and for Boston Triathlon coming together with the triathlon sponsorship.
Dr. Barnett, there's a connection because you're taking part in this event. But other than that, what is the connection between a place like Boston Medical Center and an event like this?
It's such a great question. Well, first of all, we're so honored and thrilled to be partners in this event. And really, I mean, Boston Medical Center has long been the safety net hospital for Boston and really taking care of the population of Boston. And this is really an opportunity and an event to highlight the vision that Boston Medical Center has around some of the ways in which we can take care of urban health and the health of Boston. And so personally, I have been serving as a primary care physician for 14 years at Boston Medical Center and have really been honored to be part of many, many people's lives who come through our door. And then thinking about the Boston Triathlon and all the things that we can do to improve the health of Boston and my patients and partners that we have, there's lots of different pieces where there's connections.
Well, you know much better than I do that triathlons are not for all patients, but I'm sure you talk to a lot of patients about physical activity, don't you?
Absolutely, yeah. That is truly a joy for me to watch people go from maybe not doing anything to just a little bit of activity. So really any activity is better than none. And we're not asking anybody to jump into a Boston Triathlon as part of their fitness routine. But really each part of those things, you know, the running, the swimming, the biking, I know that a lot of people get joy from many, many different kinds of activities. So a lot of my patients have actually learned to ride a bike. Of course, we talk about bike safety as part of that, or even have gone from sitting to walking and then starting to learn to run. So those are all pieces.
Now, I notice in the Vision 2030, which is the agenda for public health, really, you know, you're not just talking about people who have a risk of, you know, heart disease or diabetes. You're talking about people coping with mental illness. I mean, does physical activity play a role in that too?
That's a great question. I mean, I very happily, as a primary care physician, I feel like finally, you know, the research is, everyone's getting behind this idea of, you know, how do we take care of the whole person in order to take care of one's health, right? So we know that what I do in the hospital and what we do in the clinic is actually just a really small portion of health outcomes. Really what is the most impactful is what's happening for people in their community. So are they connected to people they love? Do they have a sense of community? If they're depressed, do they have access to a mental health clinician? If they have a substance use disorder, are they getting the care that they need? So yes, all of those pieces are really fundamentally important.
This is BNN News, and we're talking with Leslie Walstrom of Columbia Threadneedle Investments and Dr. Katherine Gergen Barnett of Boston Medical Center. Leslie, I'm old enough to say that I used to do some running in the same area in South Boston when the worst thing about it was Dorchester Bay. It was pretty foul. Has the harbor cleanup been that much of a help with an event like this?
It definitely has. It definitely has. I was actually in the water last week and pretty clean, really nice. All of the swimmers, Katherine's done the race too. It's very comfortable and feels very safe and very clean. So I think the cleanup has worked.
Now, tell me a little bit about the rest, because people, they're in the water for a while,
Yep.
and then what do they do next?
Yeah, so we have two races on Sunday the 28th. One is an Olympic distance, and so that's the longer race. So you start out with almost a mile-long swim in the bay. You run out of the water, you run up to a transition area, you put your shoes on, and you jump on your bike, and you bike about 22 miles. And then you go back to transition again, you jump off your bike, you put your running shoes on, and you run 6 miles. So the Olympic version is the first thing we do on Sunday, and then we do a sprint version, which is basically half that distance. So half a mile swim, 11-mile bike, and then almost a 5K run.
Well, why do people get into this race? I mean, most of them are not going to become famous. This is not women's soccer now. So.
No, it's I personally like it because I like the variety, because just when I'm sick of swimming, then I can do something else. I can do the bike leg. But I also think I'm someone who is very active. I do something every day, whether it's lifting weights or running or biking. And I like doing races like this because it's a good way to see if all of that hard work is paying off in some way. It's just, kind of channeling it into something for a day and challenging myself in a different way. And I think that applies for a lot of people.
Joshua, what about the location? I mean, I used to like running because I liked where it was. I mean, isn't that part of this too?
You mean enjoying where you are?
Well,
where you're running?
I mean, this particular location, Southwest, you're going by the water.
Oh, it's beautiful. I actually used to work at the South Boston Community Health Center, so that was any time that I needed a refuge, I would kind of walk over the hill and go to that beach. It's a really beautiful location. I think it's a real gem for Boston.
And finally, Leslie, if people want some more details on when and where things are happening, is there a way they can get that?
Sure. So just to recap, the race for the adults is on the 28th, which is the Sunday. Race for kids is on the 27th. Still time to register. Just go to bostontry.com. And the only other thing I would add is that for college students, there's a reduced rate. So if you want to race in the Tri, you can do that more cheaply. So it's a great way to get out there and racing.
Thank you both, Leslie Walstrom and Dr. Gergen Barnett.